everyone. Welcome back to our podcast. Today we're going to be diving into a fantastic topic. We've got Tania joining us from Australia, and we're going to be going through the differences between the UK and the Australian GP practices. Now, who better to be running through this than Tania herself? She's a very experienced practice manager in Australia and currently running multiple practices. So, Tania, welcome to the show to start with.
Thank you very much. Thanks for having me.
No, thank you for joining. Looking forward to going through this. So, Tania, it'd be good, obviously, just to kind of start with, for you to kind of just maybe introduce yourself and maybe just give our listeners a bit of an overview on who you are.
Okay, yeah, I'm a practice management consultant here in Australia. I have been doing that for quite a number of years now. I won't tell you exactly how long, so you'll know how old I am. But I started as a receptionist and worked in radiology in hospitals, and then general practice moved into that and just sort of evolved into the practice manager.
Mhm.
And I've since then been working as a consultant, so working with lots of practices, both GPs and specialists, over the years, trying to fix any issues they have or advise them on their business. And currently, I manage 3 practices in the beautiful Dandenong Ranges, just east of Melbourne, in Victoria. And they are, I guess, what you might call semi-rural practices, which are small communities, which I love.
Mhm.
So that's what I do. And then in my spare time, I also do accreditation for one of the accreditation agencies here. And I am a trainer and assessor for one of the training organisations who does medical reception and practice management training. So that keeps me busy.
I was just about to say that you must be very, very busy. Well, I know you are, but yeah, you must be incredibly busy. Incredibly busy, Tanya, and also very knowledgeable. A great person to obviously be having on this podcast, just to obviously kind of share some wisdom and some knowledge for our listeners.
Hope so.
I know so. So, obviously, to kind of kick things off, I know that you've spoken to multiple different practice managers. In actual fact, Tanya, you were here in the UK at the Best Practice Show for 2024. And I know you've been speaking with other practice managers in the UK, but it'd be good to kind of touch on maybe a little bit around, how you've found, the job kind of differs between Australia and the UK.
Well, yeah, I do have a few friends that are practice managers, and I met some more when I was in your country last year. But and I have had the opportunity to sit in a couple of practices over the years, and I guess the thing that does hit me straight away is that the structure of general practice. In the UK, it's sort of part of the NHS as an organisation, which
Hmm.
government control and that sort of thing. Whereas in Australia, it's more of a small business. There are
Hmm.
some corporate owners that own practices, but the majority of the businesses or GP practices are actually small businesses.
Yeah.
So might be owned by one person, might be owned by multiple people. The management side of it probably is very similar. A lot of similarities with what our job role is and that sort of thing. But I guess that to me is the main difference.
Okay. Brilliant. Brilliant. Really interesting in that case. As you say, it does sound like there are quite a few differences between the UK and the Australia position. But obviously, just kind of give some a bit of an overview for our listeners, really, on maybe what your specific job kind of involves.
Okay, so I, if you go by today, a lot of crawling under desks, but that's not me. So yeah, I actually see myself as the ringmaster of the circus.
Okay.
we um, we as practice managers, we basically coordinate the day-to-day running of the practice. From my perspective as a practice manager with the particular role I have, and the practice manager role does vary
Hmm.
across practices because some practices, the smaller ones particularly, or those that may be a corporate who have, a hierarchy above them, the practice manager might have less um, responsibility, or their job role might be smaller than mine. But
Hmm.
I see my job role in my practices particularly, and there are three of them that I currently manage for one owner. So I only have one person to answer to, and I look more at the strategic level type things, so the governance, the operational sort of side of
Yeah.
things,
Wow.
HR obviously, some finance, risks, quality improvement, the accreditation cycle, and all that sort of thing. IT, data management, professional responsibility, and planning and marketing, and keeping everyone happy, as I
Yep.
say, is my job.
Yep.
And then I also say it's herding cats. So it's quite varied, and I love it. I've been doing it for a long time, and I love it with a passion. Um,
Good.
it's my responsibility to be ahead of the game, I guess, to make sure that any changes, whether they're legal compliance, Medicare compliance, HR, any sort of changes like that, because we're a small business, we don't get someone who tells us, oh, by the way, you need to now do this or change this. We have to keep our eye out for that information.
Mm.
We talk to our peers. We, have certain email streams that come in, and we obviously have to ensure that the doctor's billing is maximised, because the billing system, is patient centred or patient based, and it, the number of patients that come through the door. So we've got to maximise billing opportunities for the doctors. We've got to obviously maximise doctor income, and we've got to be proactive in providing that excellent patient experience, because we're in competition with the practice down the road for patients, for
Yeah.
doctors, for all those sorts of things. We don't have patient enrolment, compulsory patient enrolment, so patients can go anywhere. And then maintaining standards, including accreditation and those sorts of things, as well as supporting the whole team. Um,
Yeah.
all the little niggles day by day, all the doctor complaints, patient complaints, staff complaints, just keeping the ship running.
Yeah.
And then, of course, proactive things like facilitating innovation, and looking at how we can improve things, and working smarter, not harder, all
Yes.
those sorts of things. So
Yes.
yeah, very varied role.
Yes. I was gonna say it's almost a case of what don't you do? I guess as you say, you are the kind of
And
the
crawl
cap.
under desks.
Yeah, you kind of the kind of the captain of the ship almost. You are quite literally doing everything, and the practice, really wouldn't be able to run without you. You're such a critical, and valuable
Yeah,
asset to the practice,
true.
are you?
Yeah, yeah, and I think you're right in that it depends on the size of the practice, as I said,
Mm.
and it depends on the structure above you. My structure above me is one owner, so him and I, we have a very close relationship. We correspond, we run everything by each other, so we have that relationship. But if you had a corporate running, the practice manager might be more directed. If
Yes.
you had a solo GP, the practice manager might not have as much to do, or certainly on a smaller scale. A lot of practice managers don't get involved in the finances;
Hmm.
they outsource that to an accountant or something. But yeah, it just depends on the skills of the practice manager. But
Exactly.
certainly in my role, I love what I do, and I love managing the whole thing.
Yeah.
Probably I'm a control freak.
Don't worry, I'm one of those as well, Tanya. Um, yeah, it's as you say, it depends obviously on the practice manager's kind of skill sets, as you say, and obviously you do have it all. But it's interesting to kind of compare that to the UK, where in the UK they're very kind of regimented on what they need to do, and told what they do. Probably very similar to maybe the corporate side of things that you're mentioning. Um, where it's a case of giving you a list of jobs and you've got to take them off, where with yourself you've got a lot more kind of autonomy, and the practice really just wouldn't be there or operating without obviously somebody like yourself, which is fantastic.
Yeah, I think you're right there. That word autonomy, that's sort of whereas I see the biggest difference, that we have total autonomy. Well, I certainly do in my role, but as a practice in general, the autonomy rests with us. And,
Yeah.
obviously the success or failure also rests with us.
Yes. No. Definitely. Definitely. And I guess obviously that kind of, whilst we're talking about the practices, it kind of takes us on quite nicely to some of the next bits that I was going to talk about, because we obviously you have managed multiple practices, during your period of doing this, and you've seen obviously, I guess, the good and the bad, and we've kind of touched on some bits maybe there already, but you know for a lot of the GPs that are going to be listening to these podcasts, they will be from the UK thinking about making a move into Australia. And
Mhm.
from your experience, what do you think a UK GP should kind of be looking out for, when they're looking at in choosing a practice in Australia?
Mhm. I mean, obviously, depends what you as a person look for for job satisfaction.
Yeah.
You need to make sure you find that in. So that would slightly differ perhaps for everyone. But if you go on the statistics, the worldwide statistics of what the top sort of things in people do look for as a job satisfaction, it's very much about the you know I guess the culture of the practice.
Hmm.
So, do you fit into that? Is that your tribe? Is that
Yes.
where, you have the support you look for? Is that where, um, you fit in with the team? Is that where you feel among your colleagues, you have support, you can give support, there is that
Mm.
collegiality there. So I guess here in Australia, as I've said, GP practices compete with each other for
Yeah.
doctors and for patients. And with the doctor shortage, there is a lot of practices out there looking for GPs constantly. And, sometimes they pinch them from other practices. It just depends on, that connection. They don't openly go and knock on doors, but, obviously, if you can create an environment where doctors want to work and the practice next to you doesn't have that environment, then obviously you're going to be better off. So,
Definitely.
the practice competes for the doctors and for the patients, and that adds that extra layer. So practices need to provide an excellent working environment, um, supportive services, so good
Hmm.
support from your practice manager, from your colleagues or other
Hmm.
doctors, from the nursing staff and admin staff. So you want to be somewhere where you feel supported. Obviously, you need to have access to patients. So if
Yes.
you're in a practice where the doctors that are there are not fully booked every day, don't have the patients, then it's highly unlikely by adding another doctor that you're going to have to work hard to get the patients through the door, at least get them through and keep them there. Um, as I said, the collegiate environment might be something that people look for, and it tends to be what makes people happy in their job.
Yeah.
Then you've got to look at financial opportunities. So, does this practice maximise their billing? Does the
Definitely.
practice, as I said, work smarter with their billing, or do they expect you to just push so many patients through an hour to earn this much money? Or, do the staff and the management and the staff have the skills to, you know, bill offer the services that bill slightly higher item numbers? Do they have nursing support that will assist the doctor so that the nurse can do part the of the consult, and bill a particular, like a management plan or a health assessment, and then the doctor can be seeing other patients while they do their bit, and then the doctor comes in at the end, and so all those sorts of things um, are important, I guess. And then I guess work-life balance. Do you want to work full time? Do you want to work 3 days a week? Do you want to work 4 days a week? Do you want to do weekends and on call and all those things? So there's lots of, I guess the UK practices similar, but yeah, finding a practice that has all those components that you're after would be something that I would suggest.
Hmm.
And as we've said, practice culture. If you're looking to be there in a long-term role, then finding that supportive owner,
Yeah.
manager,
Yeah.
good colleagues, good opportunities for education. I know in our practices, the doctors regularly do what they call small group learnings. We have clinical meetings regularly. We have which involve the nurses sometimes. Sometimes the doctors, just the doctors, but the other services there that support the GPs and you know the nursing services there. Um, the patient demographics. Another thing I guess you could look at is the patient demographics of an area, especially if you have some sort of special interest. Skin clinics, if that's something that interests you, is that an area where the demographic of the patient, would give you a reasonable amount of work from that, or antenatal services, or whatever. So there's a variety of things that you'd probably want to have a good look at and
Yeah.
sort of see whether that would be where you would fit in.
Yeah, well, I guess obviously, as you say, this is one of these where you really don't want surprises. You want to obviously be honest and have that relationship with the from the start with the practice. The relationships are a key thing. I know that from GPs that we've placed and I've placed over my years. It's a lot of it's about the connections and the relationships that they have been able to obviously build immediately. I think
Mm.
obviously, as we said, having that job satisfaction is so important. To GPs, and they're moving halfway around the world. It's a big move to start with. They need to obviously feel that they are going to be happy, that they're obviously going to be a well, joining a well-oiled, team, a supportive team, and somewhere that they can really, get that, kind of personal development, work-life balance, good earning ability, and obviously overall kind of satisfaction, which kind of also all comes to one. And I guess, speaking about support, I guess you'd be a fantastic person to kind of add on this of, how would a practice and even a practice manager, actually in Australia actually assist the doctor on, the day to day side of the business.
Well, yes, we the the structure of general practice is very much, as I said, small business. So, depending also on, and I think we're going to touch on that a little bit later about the sort of types of employment arrangements, but the support certainly should come in relation to, ensuring that you are doing what you want to do. So, are you supported to do, as I said, special interest things? Are you supported to, you know, get get a reasonable income without having to, with still giving quality care? Because ultimately, as I said, we're competing for patients as well.
Hmm.
So,
Yes.
um, it, and if a patient, this is something I drum into my staff. I mean, our reception staff are the most important staff we have in the practice, because that's their first point of contact. If they don't make a good impression, it's highly likely the patients aren't going to come back or stick around.
Yes.
So, the most important thing is that first impression. So, we talk about that patient journey from the time they pick up that phone and call us to the time they leave the practice with their script or their referral or whatever it is. Has that been the best it can be? And that's what the practice should be doing to support the GPs as part of that journey,
Yes.
making sure that the GPs patients do want to come back. I mean, the GP plays a role in that, obviously, their skill and their rapport with patients and all that sort of thing. But it's not just about the relationship with the GP; it's about the relationship with the practice.
Yes.
And so, as a practice manager, that's really my role as well. To make sure that, and of course, all the work that we do goes towards that patient journey, as well as the doctor journey, as well as the doctors who work for us, making
Hmm.
sure that they're happy. And I was looking at some statistics actually when we were talking about this, and um, this is based on the Royal Australian College of General Practitioners that do sort of
Okay.
a survey every year,
I love stats.
and and of the so just from the point of view of the structure of practice, about 69% of GPs in Australia work in privately owned practices,
Hmm.
group practices with a couple of owners or directors, whatever they want to call them. 20% are in corporates and 6% are in solo practices.
Oh,
So,
wow.
as you can see, the majority work in sort of small to medium sized practices that are not corporate owned, that are
Yeah.
doctor owned. 4% of them work in Aboriginal health centres or Aboriginal controlled health centres, and the others in settings such as aged care hospitals, those sorts of things. But it was interesting with the results that the GPs with the highest job satisfaction worked in Aboriginal controlled health centres. And I
Oh,
was
wow.
quite surprised at that.
Yeah.
And the least satisfied among the GPs were the solo GPs. Of course, the workload there is pretty high, and they're often in more rural and remote areas. So, um, but 48% of GPs felt that they were able to maintain a really good work-life balance, and the percentage of GPs experiencing burnout is decreasing and certainly since 2020, but it's decreasing every year, which is good. I actually read that and thought, wow, we always get the doom and gloom here that no one wants to be a GP, and no, we're going to struggle over the years, but it's really good to see that
Things are picking
um,
up.
you know GPs experiencing burnout is going down and their satisfaction is actually going up. So that's
Yeah.
really good.
It's really good, and those figures actually amaze me a little bit as well. Especially with some of the nitty gritty and on those percentages, which is yeah, really really interesting. And I'm certainly going to be searching for that article after we've recorded this episode. But
Yes.
yeah, it sounds like within the practice, the practice managers really are kind of as you say, very supportive. I know that from a lot of the clients that we deal with and have dealt with over the years, they are assisting kind of with that, kind of administrative tasks, helping obviously kind of make sure that patient books are being filled. They're assisting obviously, as you mentioned, on that compliance side of things. At the start of the call, obviously, and just obviously the day-to-day running of the practice, so that the GP can focus on you know being a GP, and
Yes.
if they have obviously any questions, they've got you to turn to, they've got you that they can
Mhm.
go to, but obviously together and obviously as a collective, as a practice, you're really trying to obviously ensure a really high patient satisfaction, but also making sure we're being able to maximize their earnings, I guess ethically, as well, which is really really good. And you've just kind of obviously actually touched on something that I was going to mention, which was the overall kind of satisfaction. And obviously, I know that it doesn't take a genius to work out at this moment in time, or to even read the articles that here in the UK the job satisfaction is quite low, unfortunately, or very low, shall we say. I know you've
Mhm.
obviously, again, been to the UK, spoken with a lot of healthcare professionals, again, obviously at best practice, and obviously contacts that you've got. And how do you personally find, or have found, the overall kind of job satisfaction in the UK, kind of comparing to Australia?
Well, yes, I must say that I was saddened when I was there to hear the news story. I don't know whether it was a beat up type story or whether it was based on fact about medical graduates not being able to get GP positions,
Yeah,
certainly through the training and that sort of thing. And
yeah, unfortunately, that's a
we
fact.
yeah, and it's sad,
Mm,
because here we have almost sort of have the opposite problem
you do.
in that the last few years trying to get um, medical graduates to join the GP training program, we were, we were struggling, and I've been asked to work with the college on, how we continue to get the numbers to go through the program, and how do we target hospital-based doctors to join the GP specialisation program, and how do we even maybe go back to medical students in university and how do we target them. So we're looking at different options. But, in the last few years, we've been wanting to encourage more medical graduates into the training program
Mm.
to address the shortage of GPs that we have. And there was a slight increase this year. We are
I
training,
saw
our
that.
three track practices are a training practices. We have been for, oh, before my term, but about 20 years probably altogether.
Mm.
And we have three registrars started with us this term, which was
Wow.
2 weeks ago. And we have a number of supervisors, obviously, that support them in that. And but that's part of our value system and our culture at our practice is that vocation, passing on that passing on the baton to the next generation. How can we make general practice attractive, and how can we encourage and support doctors to move into general practice and stay there.
Yeah.
So, but I must also say that I actually have worked with a number of UK GPs over the years. I actually now have one retired not so long ago, but I've had three UK GPs who work in my practices. The ones that I'm in at the moment still got two. One retired, as I said, not so long ago.
Yes.
And I guess why did they why did they leave the UK and come here? It wasn't anything to do with me because they were there before I got here. But yeah, they are very happy here, and I actually was talking to them the other week, and they said that they knew it was better here, and
Mm.
they one of them off their own back came out and tried to find a job and did it all themselves. That was many years ago. He's been here for some time, and yeah, so there's been one in a previous practice that came to us through an agency such as what you do,
Mhm.
and yeah, she's still here, still loves it, and yeah,
Yeah.
so I guess why did they come here? I guess that would be something you'd have to ask them,
Ex-
and they probably all had different reasons, but they've certainly stayed and they've
Exactly.
certainly enjoyed their time here.
It's
Um,
it's good to hear that they are happy, and for you to say that they are happy. It's such a it's one of the things that I hear all the time, just about obviously, how much happier the GPs are in Australia. They,
yeah,
as we've already touched, they do have such a better work-life balance. They are earning,
yeah,
so much more money in comparison to, working here in the UK, and I guess that kind of falls hand in hand because a lot of GPs are doing salaried posts, they're then doing locum work. They're trying to chase the money, but it finds them in a position where you know they're working crazy, and I mean crazy
yeah.
hours down here.
Mm.
And on top of that, they're then coming home and they've got obviously a lot of the admin work to do. So in Australia, there's a lot fewer kind of administrative burdens that are in place.
Yeah.
And
From my experience, yeah, the benefits of the lifestyle here, depending on
definitely,
whether you want beach lifestyle, rural lifestyle, city lifestyle, I guess there's that. I think the work-life balance, as you've mentioned,
mm,
um, and that's not at the sacrifice of income. And I always encourage my GPs in whichever, whether I've been in there as a consultant or whether I've worked long for a long period in a practice like I'm currently doing, but I always talk to them and encourage them to bill what they are worth. And that, I
yes,
guess, is the
and
thing with the Australian system, that there is no restriction on what you can bill. And we talk about it often, even in our practice meetings now. There'll be a new service, or there'll be a new, or I'll look at what doctors are billing, and what, whether they're bulk billing, or whether they're privately billing, and look at and say, patients are happy to go out and pay $200 or $300 for an hour with their hairdresser, or they're happy to pay $120 to take their pet to the vet. So you as a doctor need to realise that charging them, only 10, 15, $20 is not what you are worth. You are worth more than that.
exactly.
And and I guess they have that ability here to. I'm not saying if you charge an exorbitant amount, you'll get many patients, but it, as a practice, and this is something over the last few years, particularly since COVID, we have really discussed more and more. That we we can't continue to devalue what we do. We need to make patients aware
Yes.
that your health is worth an out of pocket amount of X amount,
Yes.
and make it viable.
Yes.
Make it so that, and that's part of my role too, making sure that the expenses and the income all match up so that we don't go out of business. So yeah, it's absolutely important that doctors learn to build their worth, and I think there's certainly a lot more scope in Australia to do that.
No, I completely agree, and I absolutely love that you just said. Obviously, bill your worth. That is almost the exact same words that I use when I'm talking to these GPs. Is that
Yeah,
you are billing what you believe you're worth, and as you say, people are paying so much money for just obviously a haircut, or for the pets. You've got people that are spending hundreds of pounds on shoes and clothes, and what is more important than your health? um
absolutely.
and I guess obviously, here in the UK, in theory, we're lucky that we've got obviously a free healthcare system, at the moment. But it's that's what's led to these GPs being so overworked, and obviously the burnout and the underappreciation, because they're just not being valued.
Mm,
If their service is
mm,
obviously a free service in essence, where does the value or the appreciation come into place? And that's unfortunately where we're seeing things in the UK, struggling.
yeah,
But
and it's very much about that balance too. I mean, we all of my doctors still what they call bulk bill patients, and I think we're going to talk a bit about the Medicare process, but where they take what the government does give you for that particular consult, and that's all. They won't take any more from the patient because they realise the patient's struggling, or the patient might have some complex issue where they have to be in every other
mm,
week, and it gets a financial burden. So they're not, and I don't know. I think I've only ever met one doctor I've worked with, and I didn't work with him for very long, but that didn't realise that burden on patients. So then, they don't look at this as solely a business. They are there to help people. That's what most doctors, why they do medicine. They want to help, people. So it's not like, but you have that option and you have that flexibility to charge those people who can pay, but you also have Medicare, which is free
mm,
healthcare for those people who can't pay. So yeah,
mm.
it's your choice, really.
Exactly. Exactly. And I guess obviously this is kind of moving us on again nicely to, kind of discussing. We've discussed a little bit there about obviously the healthcare system in the UK, and to Australia, and the satisfaction and the overall kind of side of things in that perspective. But I guess obviously when we compare the actual medical centres, in the UK to Australia, obviously there are some key differences. And obviously it does depend hugely on the practice, and also obviously the practice location. But yeah, there are obviously quite a few differences, and I know I've seen some, and I can obviously go through some as well. But Tanya, I guess it'd be good for you to kind of elaborate on some of the key kind of differences you've seen between a physical medical center and obviously a GP practice, here in the UK.
Well, yeah, I'm not sure of the statistics. I probably should have looked that up, but there are a lot of new emerging practices. I was involved probably 10 or 11 years ago now with the AMA in Victoria as a consultant. And one of our roles was to project manage and set up and open up and get accredited brand new medical practices. And we did quite a number of those. So, yes, some of the practices are very new, purpose built. Again,
Yeah.
here we are talking about competition and marketing. So, if you've got a tired old practice there and a big, lovely practice opens up down the road, where are your patients?
Yes.
Because we're trying to attract patients as well. So, yes, so you do have to take all those things into consideration, the services that you offer, the type of building that you're in.
Mm.
Also, there's a lot of practices that see a draw card, and we certainly are aware of that in our practices, of having allied health practitioners also on site. So a
Yes.
one-stop shop type approach. So having pathology on site, having an allied, various allied health, podiatry, physios, osteos, psychologists, those sorts of things. So a lot of practices within the infrastructure they have utilize or keep certain rooms or look at how many consulting rooms, but then we'll add a few extra rooms to make sure we do have pathology conveniently located.
Yeah.
And that's a room rental type arrangement. We don't have to worry about that. We just rent the room out, and we have the pathology company that put their staff there and set up or provide those services. But then, yeah, what other services? And that would obviously be based with the patient demographic as well,
Hmm.
as to what sort of services. Some practices, even the larger ones, and certainly the corporates as well, will look at visiting specialists on site as well. So, that whole patient holistic, healthcare home type model where the patients don't have to go too far from the practice. Um, Doctors, of course, still have autonomy to refer wherever they want, but often, having that collegiate environment that includes allieds is really important for the
Yeah.
doctors, and it's good for the patients, particularly in rural areas too, where patients have to travel. Um, we, even though we're on the outskirts of Melbourne, the nature of the demographics and the community that I work in is patients very much like to stay in that community. They don't like
Mhm.
to go down into Melbourne, as they say,
Yeah.
unless they really have to. So having things available at hand is handy, and is good for the attracting patients as well.
Mm.
And I guess the patient load would potentially be different. I know, again, it's the doctors control as they run their own business. They control how many they see an hour. They control, what their charges are, those sorts of things. The the technology is, I guess, there's less interoperability, which is probably in some ways it's good, but I mean it has its limitations as well. But we are certainly, that's one area where we are slowly improving. So getting discharge summaries electronically from hospitals that come automatically, getting electronic information from specialists and allied health, rather than the old snail mail and that sort of thing. So I guess that's something that we are moving. We are moving in that space. We can still do some
Yes.
more work, and they've been promising me that ever since I've been a practice manager, I think. But anyway, we're still waiting. Um, um, yeah, and depending on the practice, the equipment, the facilities, those sorts of things. The majority of practices, and again, I should have looked at the statistics, have nurses on site,
Yes.
a nurse or a nursing support.
Yes.
So, and that frees up the doctor time in a lot of ways to do other things, or see more patients, or see extra patients while the nurse is doing something else. So, um, yeah, I guess, again, as I said, depending on where you are, but as a surveyor and going into, probably been in over 400 odd practices now over the years, but some
Wow.
of them are beautiful. Some of
Yes.
them are very old buildings that have been done up, or they might be brand new purpose built buildings. But yeah, there's a wide variety out there.
I was going to say that
And
with when you compare some of the ones that I've personally seen as well firsthand, especially to the NHS, you may have seen some of the articles where unfortunately they're with the lack of funding, they're not being well upkept. They are kind
indeed,
of you know crumbling a little bit, by way of obviously the walls or bits on the roof, or they just chairs don't match, for example, or
Mm.
chairs are breaking. They got rid of a section, but they haven't actually got rid of it. They're just obviously not got any staff there anymore, so they just kind of taped it off. I know that's
Mm.
the same in my local practice, and yeah, that just wouldn't happen in Australia, as you say, because of the competition. People are wanting to, really kind of stand out from the practice next door, and they're looking at it in a
Yeah.
case of, okay, well, we need to make sure we're presentable. We need to make sure we've got obviously all the the right technology or the right services or a good team, so that we can then offer an additional things, so we can attract obviously GPs to come, and we can attract obviously the patients to want to come and try our practice
Yeah.
rather than go to the next practice as well. Um,
Absolutely.
no,
Yeah. Absolutely.
Amazing, amazing. And I guess obviously with that, patient load, obviously as you said, that can impact obviously the GP's income. So, having it where the GPs are able to choose my patients that they see. Obviously, they're getting obviously that autonomy. They're getting obviously the ability to see how long or to choose how long they're seeing a patients for as well. Um, you know, it's all down to obviously building the patient base, as we've said, which GPs get support for. But obviously, all this obviously comes into that work-life balance, that workload, that income ability, and having the support and going into a practice, for example, where somebody is as supported as what you would provide, obviously, Tanya, they're really going to excel, and that practice is really going to exceed, all the kind of expectations as well. I can imagine.
Yeah. Well, I don't think I have any of my GPs who work full time.
Wow.
The maximum is 4 days a week, and the male, that's usually the male doctors. But yeah, most of them have 1 day a week off.
I can assure you
Yeah.
right now, Tanya, that all of our listeners that will be listening to this will be very, very jealous of that, and they will be looking at this thinking, well, I only do 4 days a week, but they're only doing 4 days a week because they can't get any more work, or they're doing less because they can't get the work, not out of choice. And obviously, I think it's also critical to kind of point out that those GPs that are only working, less than full time or part time, obviously within your practices, part of the reason they're doing that is because of the earnings, because they want that work-life balance, or because they're earning so much just doing those hours that they
Yeah.
don't, they're not, I don't use the word motivated, but they don't really need to do more hours. They're happy
Mm.
with what they've got.
Well, if you, yeah, if you work 5 days a week, you wouldn't be able to enjoy the lifestyle, would you?
That's exactly
You
it.
have to have at least 1 day in the week off to enjoy the lifestyle.
Exactly, exactly. You got the wineries, you got the national parks, you got the beach. Honestly, you spelt for choice, and it's all on your doorstep. That's the best part.
Absolutely.
That is the best part. But obviously, we've gone through a lot about the practice. We've gone through a lot about practice management. We've gone through the support. I guess one of the things that we haven't and we're going to kind of gone through, and it'd be really good for us to touch on, especially with somebody as experienced as yourself, is the actual setup for GPs. The kind of different kind of almost like employment models, because there are obviously a few. It's very different to the UK. GPs here in the UK are set up as
Yeah.
employees.
Hmm.
Obviously they work for the NHS, and obviously it's very different to that in Australia, isn't it?
Yes, well, it can be. There are a small percentage of doctors that work for, through the hospital system as GPs, and that's. But yeah, with the statistics, as we said before, so and this is actually a changing space at the moment. That's something from a GP, from a practice manager's perspective. I've spent many sleepless nights over the last couple of years trying to get my head around this legal, and we've actually just currently now just gone through and renewed all our contracts for our GPs. But basically, what is happening in Australia is slightly changing the structure of general practice. So
Mhm.
yes, a GP can work as an employee, and there are practices out there. And I think it'll be interesting to see if they look at this with the next survey, over the, for 2024, 2025, whether, if this is a question, I'm not sure whether the number of employed doctors has changed because practices have been targeted by state governments around a thing called payroll tax. And I won't go into that, but it's an extra tax that potentially they're trying to put back on to practices. And so we've had to relook at the structure of what we do and make sure that our legally we've got everything tied up. But so some practices have opted to go back and employ or start employing their GPs or engaging them under employment contracts.
Hmm.
Um, the term contractors is not used anymore. So, but there are some doctors' arrangements, that is what they call a contractual arrangement. We as a practice and the majority of practices have moved to what is now known as a tenant doctor arrangement. So this is where tenant doctors run their own business. They have their own ABN or business number, and they obviously with their accountant, they run that business, paying their tax through that, paying well, what's the word I'm looking for? Paying their tax and paying their GST, or
Hmm.
doing their what they call VAT in the UK. So there are some financial and accounting work to do if you run your own business, but they run their own business.
Yeah.
So they come to us as a business entity, and they work with us under what we call a service agreement. So
Yes.
that agreement says that the clinic provides the support services that they need to run their own business. That includes the physical space and the equipment, the nursing and the admin support, the patient information management system, and the marketing or the compliance stuff that we help them with. And basically, the whole risk and that sort of accreditation all comes around. We are running this service to support you run your own business by seeing patients. And the
Yeah.
GP's income is paid directly to them
Hmm.
through this new system, and it's a private transaction, as we said, between them and the patients, or by the patients assigning their Medicare benefit over to the doctor directly. So this means the doctor needs to meet obviously Medicare requirements when they're charging item numbers, and they then pay a service fee, a percentage of their income as a service fee to the practice, and that percentage is based on their billings or their receipts, depending on what your contract with your particular practice is.
Yes.
So it's sort of a different mind shift. We've, as I said, made over the last few years, made a lot of tweaks with what we were doing to make sure that our structure very much looks like this, and so that we feel that we have done what we need to do to comply with the requirements of a service or a
Yeah.
tenant doctor arrangement under a service agreement. So that's it in a nutshell. It's a lot more complex than that, but
Yeah. Yeah. The I
so
think
that's how it looks.
yeah, the overall setup is very similar to like a bit like a locum, from like a background kind of setup. It's very similar to like a locum where they set up their own company and you say they've got their own visa, not visa people, their own, tax people, and they're doing obviously
Yeah.
their finances and their accounts obviously in the background. Um, but then rather than obviously a locum would get like a day rate, for example, that in Australia you get obviously that percentage of your billings,
Yes.
as I've touched on obviously on some of the other episodes that we've had, because obviously there are a few different billing types. Obviously, I know you've mentioned earlier on about the bulk billing, and a lot of practices obviously are also running through mixed billing and private billing. Um, it just depends obviously on the clinic itself, doesn't it? And obviously, as you say, the way that
Yeah.
the setup of that practice is,
Yeah. So the contractual arrangement tends to be where, so obviously the employee is where you're on an hourly rate,
Mhm.
and you work under the employment law, get holiday and sick pay and all that sort of stuff, but then you usually are told when you need to work and when you can't, when you can and can't work, and when
Yes,
you can take holidays and all that. Then there's a
yes,
contractual arrangement where the practice in, the practice engages you and bills, all the money goes to the practice, and then they give you a percentage of that.
Hmm.
That is what they now call the contractor type arrangement. But then this new model is very much where the money flow goes to the doctor's business. The doctor runs their business, and the money from the practice goes directly to the doctor, or from the patient, sorry, goes directly to the doctor. And then the the practice actually invoices the doctor, usually on a monthly basis, but it might be less than that, for their service fee.
Yeah.
And that is worked out based on generally a percentage of what the doctor earns. So the
Yeah.
doctor doesn't earn the percentage, the doctor pays the percentage to the practice. So
Yeah.
um, that's sort of how it's changed. But most practices that have moved their doctors from the contractual type thing to this new tenant doctor thing, there's really no change in the amount of money the doctor has, or at the end of the day, their net income, and there's no change in the income that the practice has to work with. It's just the way the structure of how the money flows
Yes.
that has changed. So
Yes.
there's really no disadvantage to the doctor or the practice in that. Probably a bit more work for the practice admin and the practice manager, but that's neither here nor there.
Yes. I'd say, what's a little bit more work, Tanya? It sounds like you're already doing everything else. A little bit more work is it won't make too much difference.
No.
But obviously, I guess when we've been discussing some of this, it's it'd be good just to kind of touch on and to obviously get your kind of overview and explanation on Medicare and the billings, because it's a huge part of this, the way that the system is in Australia. And we've touched on obviously a little bit in this call. We've I've mentioned obviously in other episodes as well. But obviously, it'd be good for you to give an explanation on Medicare.
Sure. So the Medicare, unfortunately, it was sold to Australians as free healthcare, and that's the stigma we are now trying to address with me telling doctors to bill your worth,
Yes.
because government tells you if you do a 15-minute consultation, you're worth $40. But we all know a GP is worth more than $40 for 15 minutes. So if we take it, that Medicare is the gold standard, or the standard that we should look at for what a doctor is worth. No, I'm sorry, that's actually not the truth. So it's not free healthcare, and what Medicare is based on is an arrangement. The constitution of Medicare is actually an arrangement between the patient and the government, that if you to have access to healthcare, we will reimburse you X amount of money to basically help you with the cost of healthcare. Specialists, when that happened, when they bill patients, they can potentially charge $300 out of pocket. Medicare will reimburse the patient X amount, and the specialist bill is a lot bigger than what Medicare will, and the patients don't seem to mind. With general practitioners, over the years, the government's tried to tell them that they should not charge above the Medicare rate, and unfortunately, that's got to change, because the Medicare rate has not kept up with inflation,
No.
and therefore, when inflation tells us, or Fair Work tells us, that all our staff need to have a 6% pay rise, how do we fund that if we can't increase our income to match? So,
Exactly.
Medicare, the Medicare system is, as I said, is an arrangement between the patient and the government, and that's what we've had to, when we've had pushback from patients about increasing our fees. We've said, well, this is what we charge. The fact that Medicare is only going to rebate you that much is something you need to go and speak to your federal member of parliament about, because it's got nothing to do with us, And patients are learning that. Unfortunately, as I said, over many years we've been told we should be able to go to the doctor and not have to pay anything, but unfortunately that's not the way it works, because we wouldn't be able to keep the door open if
No.
if that's what
No.
we relied on. There are bulk billing practices out there. Um, there are getting less of them because it's a financial struggle to run a practice solely based on Medicare.
Yes.
I guess the thing with Medicare that any doctor and my registrars that have come in, particularly my baby registrars, as I call them, that have come in this term to start their term, they've come from the hospital system where they don't have to worry about what item number they charge a patient. It's all done through the hospital.
Exactly.
Whereas the responsibility is now on them as a GP to bill appropriately and to bill using the correct item number based on the description of what the service they've provided, how closely it matches the description of the item number they're billing. So
Mm.
that's the biggest learning curve for them, and that's something as new GPs. We spend a lot of time overseeing to make sure that they are compliant with their billing. And that is something else, I guess, if you're looking for a GP practice, making sure that the practice manager is across the Medicare billing, so you're not opening yourself up to potential risk and litigation if you get audited by Medicare. So yeah, it's very much it's a moving feast. Sometimes the item number descriptions change, and we don't always get that information in a timely manner.
No.
So again, practice managers, I keep my ear. I read Facebook pages. I have email streams. There's so much I'm trying to keep on top of, so that if anything changes, I can inform my doctors that
Yeah.
okay, now to get that item you need to do this. I mean, the majority of the stuff is simple and straightforward, but skin lesions and some of the procedures get a little bit complex after a while, and they require, and even my GPs now, even the ones that have been working there for many years, will still come out and say, can I bill that item number for this, can I, or do I have to do this? So it's yeah, it's just part of what it is. So being aware that the practice manager being aware of how to bill and how to negotiate Medicare is extremely important, but also being aware that you won't know everything. You're not expected to know everything.
Yes.
There are lots of great doctors forums and Facebook sort of groups and things that do provide information, and doctors are quite often come to me and say, "Oh, I heard on this forum that blah blah blah." So we look into something, and say, "Oh, yeah, looks like that's changed or whatever." So it's very much, as I said, that support is out there, but it's just being aware that just need to basically keep on top of it and make sure that you're doing the right thing
Yeah.
and billing the correct way.
Yeah.
Medicare audits are not really common, but they are not, it's not. It's not that you'll never have one. Um, you might do. You've just got to be prepared, I
Yeah.
guess. You can't sit back and say it'll never happen to me, because you just never know.
You just never know.
And they do random audits from patients as well. We've had a couple of instances with patients who they've rung and said, you know, you saw this doctor, he billed this item. Um, was that what you are aware of? Because our obligation as a practice is to tell patients
Yep.
exactly what they are being billed, what item number, particularly if we bulk bill them, as we say. So making sure that all patients sign over their entitlement to that amount of money, because as I said, the arrangement is between the patient and the government. It's not between the doctor and the government. So if we say, look, we're happy to take what Medicare gives you, then they have to sign that over to the doctor by physically signing something. And if they haven't done that, and Medicare checks on them, then they come back and ask the doctor or the practice why not.
Yes.
So yeah,
Yes.
there's lots of little things that just have to be, and it's important that the GPs are aware of that, and it's more important that the practice manager is there to guide.
Mm. But I guess obviously, as you say, there is obviously that support out there and that support network within your
Absolutely.
practice. And obviously, at the end of the day, Medicare is there, you know, for almost kind of the opposite to the UK way. It's actually there and it benefits the GP because they are being able to charge obviously their worth. Obviously, yes, the patient's getting obviously part of it and being able to obviously claim part of it back, but the GP's actually been able to charge their additional worth that we kind of the section that we call the kind of the gap payment,
Yes.
which obviously is where the patient's going to be, out of pocket. But obviously, as you say, they are becoming, more and more aware of that. They're becoming more and more used to it. It's not alien. Um, but Medicare certainly do need to, look at, ramping their fees for obviously the numbers, just a little bit more, because as you say, it is quite low, what Medicare
Mm.
will pay in comparison to some consultations that are out
True.
there.
And doctors are allowed to charge things that are not related to just with no item number. If they do a service where there's no complying Medicare item that looks like what we've been talking recently, because we offer iron infusions, and there's often a lot of chatter among practice managers that decide to offer iron infusions. Well, what can you charge? Well, there isn't an item number for that. So basically, you need to have that policy in your practice as to how if the doctor does come in and do part of, does do a consultation type thing, then that would be what you could charge. But then all the nurse's time and the equipment and things to actually do the iron infusion is often totally out of pocket, because there isn't an item number that meets that. So
No,
so there are instances where patients are charged a non-Medicare refundable charge. That's just the way it is, because there isn't an item number to match it, and the service is there. So as long as you inform your patients of any costs before you do anything, then um, that's quite acceptable too.
no,
So
exactly. No, brilliant, brilliant. You've just had a really, really insightful overview, on everything so far, Tanya, and it's been fantastic. And I guess obviously as we start to kind of come, towards the end of this episode, together, it'd be good to kind of just maybe just kind of wrap up by gathering maybe some of your final and best and biggest pieces of advice for UK GPs that are considering this move.
okay, I guess from a from a practice perspective, I think the important thing, and I know for us, because you know when we're recruiting doctors, and we're very lucky, as I said, being a teaching practice, about 80% of the GPs who work in the 3 clinics that I manage are past registrars who have done some training with us and then come back to work with us, which I think says a lot for the culture of the practices that we run. A lot of that has to do with the practice owner. He, the way he manages his practices, the way he um, um, has that, I guess, collegiate type relationship with the doctors that he
Yeah.
works with. He's very supportive. His answer to every crisis is buy chocolate. And then let me fix up the problem. So, but yeah, it's really important that that you do have that. So I guess do your research,
Definitely.
understand. I mean, not only on where you want to live in Australia, and as I said, there is beaches, there is cities, there is mountains, there is what do you call it, rainforests. There is open red desert out in the middle there, and if the GPs with the most or the highest job satisfaction work in Aboriginal controlled medical centres, there's quite a few of those out there. So then not only find that, but find, as I said, find your tribe, do your
Yeah.
research, understand how that practice operates, ask about the support systems that are in place, meet the practice manager, meet the team, ask about the billing, and look at, how the practice supports you working smarter, not harder.
Hmm.
You could push through a patient every 5 minutes and, potentially earn a reasonable income, but how long is that sustainable? How safe is that for your patients? How satisfying is that as a
Yeah.
GP? So there's lots of things that you want support from the practice in. And the location, as I said, and the lifestyle need to suit what you're after. Although, as I said, you can get you can get beaches one place, and a couple of hours or a half an hour away, you can get rural open fields and or wineries or snow mountains, or it's all sorts of things that you can actually look for.
Exactly.
And I guess um, very much it's your work, isn't it? If you can earn the income, working 4 days a week and have the lifestyle that you want, if the patient demographics are what you want, if they meet your needs, um, if you want to do something, specializing in something, is that patient demographic going to meet your needs? Yeah, so lots of things that you could potentially look at, but ultimately, I think, a nice place to work where you feel at home um, is probably the most important.
Yes. Yes. No, that's fantastic, fantastic advice, and Tanya, it's been a pleasure obviously having you on this episode, and you said obviously, as I say, some really really valuable. Everything that you said is hugely valuable, and a lot of our listeners are going to really appreciate this. So thank you very very much, obviously, for your time this evening on your side, and thank you obviously for joining us. Thank you for joining us today.
Not a problem, and yeah, all the best with anyone who wishes to come to Australia. And who knows, we may see each other around the around the place sometime. There's lots of practice manager and GP conferences and things like that. So yeah, and
Listen,
wish
yeah.
anyone who comes here all the best. Um, I don't know what the future will bring here either, but at this point, we're doing okay down here. Although it was 38 degrees today,
We were
so
talking about this before we started. Yes, we're in the UK. We've currently got 2 degrees. Tanya says sat there with 38 degrees, and I was checking my weather forecast app this morning, and we are being blessed in the UK with highs of 4 degrees. So Tanya, I know who's got it better. I,
well, yeah. Although, as I said, we were where our one of my practices is anyway. It's quite surrounded by bush, so we are always on alert for bushfire and making sure we don't have to evacuate. But all good today.
yes.
It's worked out really well, and we just the processes are there in case, but thankfully we haven't had to use them. And yeah, just another one of my jobs. Tick it off. It's in my
Exact.
job description somewhere.
Exactly. Exactly. Well, again, Tanya, obviously, thank you very, very much. And obviously, just to, wrap things up here. Obviously, for our GP listeners, if you are thinking or considering a move into Australia and would like to find out more, please do check out our other episodes. Please do reach out to me on the details that will be around this screen, and obviously please do subscribe and share obviously these episodes with your colleagues that may also be interested as well. Again, thank you very much, Tania, and thank you to our listeners.
Thank you. Bye bye.